Good morning, everyone. 52 cases again yesterday, 30 of them linked and 22 still under investigation. 10 of them were in quarantine during their entire infectious period. We're aware at least 29 were infectious in the community. 13 in hospital, 3 requiring intensive care, and all of the intensive care patients are on ventilation. As I said yesterday, the next 2 weeks are very important for us to reach some significant vaccination milestones that are set out in the ACT's pathway forward. So over the next 2 weeks, we anticipate 32,000 Canberrans will receive their second shot and become fully vaccinated within ACT government clinics, and tens of thousands more will complete their vaccination program through local GPs and pharmacies. The overwhelming majority of these Canberrans are people aged under 40 years. Last month, September, was a very tough month for the city, but the signs are that with a very strong vaccination program, that by the end of October, and going into the month of November and then into the summer, there will be better times ahead for our city. There'll be more opportunity for families and friends to reunite and for more people to get back to work. But we have the next 4 weeks of intense vaccinating to do in order to make that a much safer late spring and summer period for our city. On the testing front yesterday, 3,241 tests, so again a really good level of testing. There are more exposure sites that have been listed though with the increased case numbers. So again we ask people who have been in those exposure sites at the times listed to come forward for testing and to please isolate whilst you await your test result. If you do need to stay away from work for a period for your isolation, there is an ACT government one-off payment that is available. If you aren't then able to go to work because you're isolating, we will provide you with an assistance payment. Yesterday, we saw a shift in the Territory's vaccination program. There were more second doses of the vaccine delivered than first doses across ACT government clinics. We are now at a point where 63% of our eligible population are fully vaccinated, and we have nearly 92% of our eligible population with the first dose of a vaccine. So today, our appeal again is to those remaining Canberrans who are eligible to get vaccinated to please make a booking, either through an ACT government clinic or with a GP or pharmacist. There are appointments available over the coming days, over this long weekend and into next week. So please put your name against one of those bookings. Now, yesterday afternoon, the National Cabinet met for around 2.5 hours to discuss a range of important issues. I outlined those in detail yesterday. Some of the more significant matters on yesterday's agenda, such as international travel, were announced before the meeting. Due to the time that many significant papers were provided, and with New South Wales not participating at all in the meeting due to the Premier's resignation, a number of issues simply could not be resolved yesterday. However, National Cabinet was briefed on plans to increase vaccination rates amongst disabled and Indigenous Australians. We also noted the preliminary advice from the Australian Technical Advisory Group on Immunisation, ATAGI, on booster doses. Now, ATAGI will provide further advice on third dose requirements for specified individuals to complete their primary course of vaccination in October. The Commonwealth will also provide an update on boosters and third dose vaccinations following advice from ATAGI There is significant planning underway with states and territories to commence a booster and third shot program in late 2021, subject of course to the final ATAGI advice. National Cabinet also noted AHPPC statements on schools, on making vaccinations a condition of employment for healthcare workers, on ventilation in indoor spaces and visitation in aged care. We received advice from the Health System Capacity Cross-Jurisdictional Working Group on surge planning in our health system. All state and territory health ministers from both sides of politics have written to the Commonwealth Government outlining a range of issues that will need to be urgently addressed to prepare the health system for what is coming. These are crisis funding for hospital demand pressures, support for management of COVID cases in the community, ways to address discharge delays for aged care and NDIS participants within the hospital system, and funding to extend the operation of existing mental health crisis clinics and extension of crisis supports across all Australian jurisdictions. The Commonwealth has been asked to consider these issues and to respond to them as soon as they can. National Cabinet also received an update on modelling from Professor Jodie McVernon of the Doherty Institute. National Cabinet noted but did not yet endorse the interim analysis showing the test, trace, isolate and quarantine measures that will continue to contribute to controlling transmission of the Delta variant. We also were briefed on the case-initiated contact tracing system that has been used in the recent New South Wales outbreak and how this can effectively assist public health responses in outbreaks where there are very high case numbers. All of this combines to deliver effective but partial test, trace and isolate quarantine impact. National Cabinet further noted an interim update on a 7-day home quarantine system for vaccinated arrivals and modelling on the infection risk that would pose. To assist with further planning for possible future 7-day quarantine arrangements, all states and territories have committed to providing more detailed data on COVID cases recorded in their hotel quarantine systems. As we heard before the meeting, the Commonwealth will introduce an international COVID-19 vaccine certificate for outbound travellers to present at foreign borders and at the Australian border. The new international certificates will become available for Australians by the end of October, we were advised, and they will be available both in a digital and printable form. So National Cabinet considered a wide range of issues, but not all were able to be resolved yesterday. So in summary, for those who've joined late this morning, 52 new cases overnight, 30 of them linked, 10 in quarantine during their entire infectious period, at least 29 infectious in the community, 13 hospitalised and 3 in intensive care. Dr Coleman will now provide an update on the cases overnight and the epidemiology of our outbreak, and then Dr Coleman and I are available for questions. Thank you.
Good morning, everyone, and thank you again, Chief Minister. So just to confirm, we have 52 new COVID-19 cases. So you haven't misheard, that is 52 today and 52 we reported yesterday. The total cases for this outbreak is now 939, with the total number of recovered cases now 617. We currently have 319 active cases. And again, I'll just highlight the key points. So of the new cases, 30 can be linked to known cases or ongoing clusters, with 22 still being investigated and of the 30 that are linked, 14 of these are household contacts. Of the 52, we know at the moment that 10 were in quarantine during their whole infectious period, and 13 still remain under investigation, but at least 29 did spend some time in the community for at least part of their infectious period. 13 people were in our hospitals as of 8 p.m. last night, 3 in ICU, all 3 requiring ventilation. 8 of these are unvaccinated, 4 are partially vaccinated with 1 dose, and 1 we have unknown vaccination status at this point. Our youngest patient in hospital is in their 20s and the oldest in their 80s. You will see some areas of the ACT Courts building listed on the exposure locations this morning, amongst others. But please remember that for the ACT Courts building in particular, this only applies to specific areas at specific times. And it's the same, make sure that you take note of this for all our exposure locations. If you were there outside of these times, then no specific action is required. We work very hard to try and limit that exposure period time frame to have as limited impact as we can on people from a contact perspective. I can assure you that we do continue to watch our daily case numbers as we gradually ease out of lockdown over the next couple of weeks, and the analysis of these cases continues. And the next comprehensive update on the status of the outbreak will be on Tuesday, where we will have had time to consider what's been happening in the last couple of days, have as much information as possible at our fingertips, and I can talk to you then in a little bit more detail about what we're seeing. So my shout out today is to our local ambulance crews, paramedics and patient transport teams. We're actually really lucky in this city to have such a dedicated and experienced team on hand to help us in times of specific need. I know that they work tirelessly to deliver the highest level of care and support, which of course has been quite challenging as well in the era of the pandemic. I know that these crews go the extra mile in providing both patient support, reassurances, and are often a comforting smile for people when they're feeling unwell or anxious. So thank you everyone working in these roles. Your commitment and your support is valued by everyone. Thank you very much.
Thank you, Dr. Coleman. Happy to take questions.
Chief Minister, another day of high cases. What does this mean for our plans to get out of lockdown in a fortnight?
Well, look, at this stage, no change, but we'll obviously have an ongoing review of case numbers and other, mitigating factors that counterbalance the increase in case numbers, the vaccination rate being the principal mitigating factor. At this point, early in October, with a first dose rate now approaching 92% of the 12+ population, I think that's a very encouraging sign that we will track towards 95% and above of the population aged 12 and above over the course of October. It's why we only made a cautious and small set of changes that came into effect yesterday. And it's why the first step out of the lockdown on the 15th of October is again a cautious, small step forward. The more significant changes in terms of the public health restrictions don't kick in until the end of October, by which time the 26% of the population who don't have a second dose yet will have all gone through the vaccination program. So with a 3-week dosing interval for Pfizer, people who get vaccinated this week will be fully vaccinated by the end of the month.
How concerned are you, I guess, at 2 days of 52 cases then? Do you have in your mind, if this gets worse, we will have to make some changes, or are you quite comfortable given how promising our vaccination rates are?
Well, look, our vaccination rates are a really significant way that we can protect the community. As always, we will take advice from Dr. Coleman and the epidemiologists on the caseload. We're also very conscious of the implications across our health system. And look, the other factor that has been there throughout is what's happening on the other side of the border. So I think Queanbeyan have had a big number of cases again today as well. And we have been experiencing significant demand in our health system from regional New South Wales. So part of the political disruption in New South Wales at the moment and the uncertainty there does create another layer of uncertainty in what is already an uncertain situation. But I certainly wouldn't want anyone to get the impression today that that we are talking about walking away from anything that we've committed to at the moment, but we are obviously very closely monitoring the situation. I would prefer that case numbers were in the teens, not at 50. But what we've seen from these cases is we know where they've contracted the virus in large part, and we know that it's continuing a pattern that we've seen throughout this wave of cases in the ACT, that once someone gets the virus, they bring it home with them and they infect everyone at home, pretty much. Your only way really not to be infected if you live with someone who is if you're fully vaccinated.
What did you... Sorry, go on, you go on. What was your immediate reaction? What did you say when that number 52 came at you?
Well, I guess in emoji talk, it was a little bit of a wide-eyed response, like, okay, that's a high number, higher than we would like, and that's why we've been very clear with the community that we are still in lockdown, and that the next 2 weeks are really important, that we don't see 50 become 100. We don't want that. That's in the hands of Canberrans. I just say to people, don't take risks this long weekend, and don't take risks over the next few weeks.
Why does the number of infections matter if everybody's vaccinated? Are you still going for 0?
No. So there's the very strong correlation between the number of infections and then the number of patients who will present into the health system. So at the moment, the hospitalisation rate in Canberra is roughly about 10% of all cases end up needing hospital treatment. The national data, which takes into account New South Wales and Victoria, so slightly lower vaccination rates, particularly in Victoria, is seeing about 13% of all cases requiring hospitalisation. So whilst our number of cases at we're sitting around 1,000 is significantly smaller than the tens of thousands of cases across New South Wales and Victoria, we are seemingly seeing a slightly lower level of hospitalisation as a proportion of all cases in the territory, which you could extrapolate as being our higher vaccination levels being a contributing factor to that slightly lower level of hospitalisation. But to put it simply, why vaccination matters is that, based on our figures, our hospitalisation rate, that for every 1,000 people you vaccinate, that's around 100 fewer hospital presentations and probably 10 fewer intensive care presentations.
International travel was on the agenda yesterday, discussed at National Cabinet. Will the ACT open up to overseas travel, allowing people to do 7 days home quarantine once vaccination rates hit 80%?
Well, look, the Prime Minister indicated that the international borders likely to open in mid-November, by which time I think we'd be at 90% or above. So it's not, for us, it's not linked to a vaccination percentage. It is obviously time-based. And we don't control the international borders, so that's a Commonwealth decision, but it was pretty clear from the announcement yesterday that that's likely to be mid-November for vaccinated people only. And yes, we would allow home quarantine in the ACT. I mentioned in opening remarks the Doherty Institute work in terms of modelling the risk associated with returned international travellers, likely a 7-day quarantine arrangement at home. The issue for us will be that there won't be direct flights to Canberra Airport in the first phase, so we will just have to negotiate a travel agreement, an arrangement for people who land in Sydney initially, I suspect, and then probably in December in Melbourne, to then be able to transit back to the ACT to do their home quarantine.
But surely those high vaccination rates certainly make you feel more confident in that plan.
Yes.
Yeah. The federal government will recognise 2 more vaccines from China and India. Do you hope that will make it easier for international students to return to Canberra?
Well, it certainly would appear so, yes.
I also wanted to ask, you mentioned the National Cabinet, all of the health ministers have requested extra funding from the Commonwealth to assist with our response to COVID and keeping our health system afloat. If the Commonwealth doesn't respond favourably to that request, what will our health system look like?
Well, it will be under more pressure than it would otherwise need to be. So the specific requests on the crisis funding for hospital demand pressures really go to extending the funding guarantees that the Commonwealth had put in place from the beginning of the pandemic, to continue those out to 30 June 2024 and to agree to the 50-50 cost-sharing arrangement that's currently in place between the Commonwealth and the states and territories, to extend that to 30 June 2023. So that's the specific funding ask. We're also asking for more support from the Commonwealth in relation to hospital in the home program, so effectively caring for COVID patients in a community setting. Not everyone will be so sick that they need to be in hospital, but they will need ongoing care and support in a home setting. And so most states and territories have really good hospital in the home programs, but we will need the Commonwealth to partner with us to scale them up, because the number of people who will be in those programs will be much larger than is normally the case. Then the discharge delay issues associated with NDIS and aged care. This is effectively where you see the admission of NDIS participants and older patients into hospital. That continues unabated, but there's really been no improvement in discharge rates for those patients. The Commonwealth is, of course, responsible and has the funding and regulatory responsibility for both the NDIS and aged care. So to put it in very simple terms, there are a number of people in hospital who would be better in an aged care or NDIS supported placement rather than in hospital. That frees up beds in hospital for COVID patients. So that's the practical reality there. And then on the mental health side, as I mentioned, we recognise that there's going to be an ongoing mental health need. The Commonwealth have partnered with states and territories in this area already. And so the request from all health ministers, which is endorsed by all First Ministers, with the exception of New South Wales, obviously, because they weren't at the meeting yesterday, is to see those sorts of partnerships continue.
That sounds like a relatively hefty funding request. Will we cope without it?
Well, no. We'll need the money.
You also mentioned there was discussion of vaccination rates for the disability community and also the Indigenous community. Can you elaborate on what those discussions involved and what the future may look like? Yeah,
so I think the Commonwealth have acknowledged that the programs to date have not hit the targets that they would have liked. And so even though the ACT is better than everywhere else, there is still a gap in terms of the level of vaccination for the general community as opposed to the overall levels of vaccination for Aboriginal and Torres Strait Islander Canberrans and Canberrans with disability. So these are areas the Commonwealth have had a particular responsibility. We have recognised at a state and territory level that they're not going to get there without our support, and so we're going to need to do more, and we are.
Is more mandating?
No, more is getting vaccines to people. That's been
supply. We're dealing with a supply issue once again.
Well, yeah, I mean it's less so in the ACT, but one of the issues, and we've seen this play out in other jurisdictions, is that the vaccination rates in remote Indigenous communities in many states and territories is well below that state and territory average. Slightly different set of circumstances in a city-state like the ACT. That's why our vax rates are much, much higher, like 20 or 30 percentage points higher than the rest of the nation in most instances. But we still recognise that, particularly on the NDIS participant side, that we need to get more vaccines to people. We're looking at our access and sensory clinic. We've obviously got a dedicated facility, but we also need the Commonwealth to do more in terms of getting vaccines directly to people rather than expecting people to always have to come into hubs. That's the balance. The Commonwealth have generally taken responsibility for getting the vaccines to people, and the states and territories have generally done the big mass hubs. One of the reasons for the lag is that the Commonwealth have not been as efficient as they would have liked, I guess, in getting the outreach and getting stuff, getting vaccinations to people, particularly in remote settings.
In terms of the crisis funding for hospitals in the ACT, if you don't get the money, I mean, would it be quite nice to get the money, or are you talking about a serious crisis? I'm
talking about a serious crisis, and so this will also be a three-way funding responsibility, because the New South Wales government will also need to chip in here, because we'll be treating a lot of regional New South Wales patients. I mean, we would anticipate as standard practice is that 25% of patients in Canberra hospitals are New South Wales residents, and 50% of patients in intensive care are New South Wales residents. So we would anticipate the COVID numbers being similar, if not higher, than those sort of standard levels of acute and intensive care presentation in the health system.
So what kind of money are you talking about? And paint me a picture of Canberra Hospital if you don't get that money.
Well, it will, depending of course on how long the pandemic continues, would be tens of millions of dollars, potentially hundreds of millions over the course of a year or more, depending on, again, how long we are needing to surge.
Needing or spending, needing extra.
Yes. I mean, look, the health system has a lot of pressures on it. And COVID is adding to those pressures. And it's not just the ACT, it's every state and territory. That's why every health minister, Liberal and Labor, in every state and territory has signed this letter to the Commonwealth.
I have a question from...
Sorry, can I just...
Oh, yep, sure.
Yep.
And can you paint me a picture of Canberra Hospital? What goes begging? What happens?
Well, previously we've had to scale down a range of health activities that would be deemed non-urgent. That's included elective surgery in the past, but we don't want to do that. And a lot of it is going to depend on the highest possible vaccination rate to put the least amount of pressure on the health system. The more that we can do in partnership with GPs and the primary healthcare network in terms of supporting people who are COVID positive outside of the hospital system will also contribute. And that's why that's part of what health ministers have responded when put forward to the Commonwealth. The more beds we can free up within the health system by being able to appropriately place aged care and NDIS patients into appropriate settings, which are aged care facilities and NDIS supported accommodation arrangements, that frees up capacity within the health system as well. Some of these issues are not new. They've been around the health system for many years, but there is an urgent imperative now for the Commonwealth to work with the states and territories to improve this situation, all of which frees up capacity in the hospital to respond to the inevitable increase in COVID patients. Because whatever the case number is for Canberra and our region, we can expect, it would seem, 10 to 13% of patients to need hospital treatment.
Chief Minister, this is the last one from me, and it's actually a question from a punter. The roadmap refers to less restrictive travel in our region as of October the 29th. What do you mean by the region, and what does less restrictive travel in the region actually mean?
Okay, so the region, we hope by then, will be an expanded number of postcodes beyond the standing exemption ones that we have in place now. So, look, roughly speaking, we'd be talking about probably within 100, 150 kilometre radius of Canberra. Less restricted will rely largely on the New South Wales travel requirements. So what my understanding of them in the month of November is that only vaccinated people can travel in regional New South Wales. So at the moment, there's certain parts of regional New South Wales that we are not allowed to go into at all because New South Wales has declared us a COVID hotspot, with the standing exemption of those small number of postcodes immediately proximate to the ACT. So by November, after the 29th of October, I would anticipate the number of postcodes to increase to include a wider range of areas. So for example, places like Goulburn or Braidwood that are currently outside of the arrangements. Possibly not the South Coast yet, though, I don't know. This will be a decision New South Wales will make. It's their state. Obviously, without a certainty on the Premier, all of those sorts of political uncertainties, I just don't know. A lot could change with a new Premier. We just don't know. Okay, thank you.
Dr. Coleman, how did you feel having to again tell Canberrans that we have 52 new cases? How concerned are you?
I think my response was in two parts. Initially, my heart went, oh, not again. But I think on reflection, and as we have been talking about, this isn't unexpected. It may just be happening a little bit earlier than I was hoping for. That's why we need to just have a look at the next couple of days and see what this holds. We are in a position to do what we need to do and to respond to this. But as I think every single person who stood up here and had the opportunity to talk to the community, the most important thing we can do is to get vaccinated, and that will help to smooth out our journey in terms of reaching that level of cases that we can expect to see in an ongoing fashion.
More broad update on Tuesday, but just to give Canberrans a bit of clarity, what is it that you'll be looking at over the next few days? What will you be keeping your eyes out for? What will alter your decision making?
Yeah, so I think we're going to go on a bit of a journey, and we're still working out what we really need to focus on as we transition through to where we're going to be in November and December, which is a little bit why I'm trying to put you all off until Tuesday once we've really nailed that. But in effect, it's the same things we've always looked at. We look at the number of cases, we look at the number of cases who are vaccinated, and therefore the number in hospital. The hospital factor and the ICU factor is the most important thing that we need to look at. Our aim as we move towards our COVID normal state is going to be about reducing our morbidity and mortality, or reducing the number of severe illness and the number of deaths associated with COVID moving forward. So that's the principal thing, and we know that vaccination is the thing that reduces that. But I do think the other thing we'll be looking at is what are the specific circumstances where transmission is occurring. So we know that it's occurring in households, and there's not a lot we can do about that. So our pathway forward will be looking at how do we get on top of that really early, and how do we engage community in assisting us with that. And the Chief's already spoken about something that was discussed at National Cabinet, where we'll be seeking people's assistance in making that happen. But there's also this issue of work, and also about the things that we do out in the community. And I think our focus will be moving more towards what advice can we provide to people to actually voluntarily limit the risk of transmission to themselves as well as to other members. So looking for learnings in our data in terms of what we can stop now so that we can have the minimum number of cases when we actually open up, but also how that will work in the future.
You don't have any concerns about the decision to ease those restrictions, allowing more time outdoors, 2 people in homes?
Oh, look, there's a little bit of nervousness at every point, I think, for everyone working in public health about easing restrictions. But look, this is a constant balance. This is what we do. We look at the risk. We look at the risk of COVID spread, but we also look at the adverse or the unintended outcomes of what we're doing. There's a lot of impacts in community, mental health and wellbeing. There's a whole lot of business impacts, and we need to make sure that we're taking a reasonable pathway forward. I think we still have the balance right. And I think that the majority, I know that there's some concern in the community about the pathway forward. Come with us. We'll do as much as we possibly can to protect you. This is going to be hard, but I think we've got the settings right at the moment.
If you were a betting woman, what do you think the chances are of hitting that October the 15th target? 50-50?
So which target are you meaning on?
The easing from October 15th.
So I come from WA, and betting's not really big in WA, so we don't even have those machines in our clubs. But look, I am still reasonably confident. I think, as I discussed with everybody yesterday, my intention is to deliver that lifting of restriction as is in the pathway. And we will do everything we can to keep on top of this. If everybody assists us to do that, my intention is to deliver that.
Reasonably confident? It should happen, or it's going to happen.
You're asking me 2 weeks out, which is still more than one incubation period out of a 2-day higher level of cases. I am not a betting person, and so I'm not going to put my money on that. I can promise you, though, my intent is to deliver it, and if we do make any changes to that, they will be carefully considered.
Can you provide any more information about where any sites of transmission that we know about that have been linked to these 52 new cases? Have any of the clusters that we're aware of grown?
Not specifically. I think there are 2 clusters which we haven't talked about, which are focused on childcare in Queanbeyan locations. So I'll have a little bit more detail to talk to about those. As far as I'm aware, there's no more cases in today's numbers associated with our aged care outbreak or our construction site cluster. So we're still working through those.
Whether any additional wards at Canberra Hospital have been affected by COVID-19 in recent days?
So additional to what?
The 10A ward that we already knew about. We've just heard reports that it has spread into other wards.
So I will just check my information from the hospital to make sure I let you know the right thing. So we know about the 10A ward, and we believe that we've done lots of testing around that, and we're reasonably comfortable with that. We do know that there has been a staff member working on Ward 12B at Canberra Hospital that has tested positive, and all indications is that they were wearing appropriate PPE, and our hope is that there will be no further spread from that, but we're working through that. And then overnight, not included in today's figures, there is a notification of another case in the hospital, which we are working through this morning.
And in the same way you dealt with the 10A outbreak, that was a whole heap of testing of patients and staff members. Is it a similar protocol with the 12? Oh, I can't remember if it's 12A or 12B. 12B.
Yes.
With the 12B staff.
Yeah.
Will it be a similar?
Yeah, so I think there's several steps involved in when we respond to a case in a high-risk setting, whether that's a hospital or an aged care facility. The first one of those is collecting as much information we can about the risk of exposure to other people. And I think in this case, and what we're generally seeing in the hospital, which is fabulous, is that staff are vaccinated and wearing full PPE. So all of that planning and preparation that's being done is having a really good implication for onwards transmission. So once we then we look at who else might have been exposed, and we run through a testing regime to just see if there's anything, what we call mopping up, and seeing if there's any transmission. So that's exactly the same process with varying degrees of levels of testing.
Last one from me. We know of a mixed residential commercial site in Braddon that there are potentially multiple cases of COVID-19. Can you provide any information about that site or what's going on at that site?
No, not specifically. I do know there are a couple of other cases included in today's numbers that have links with several additional construction sites, but I don't have any specific details on a Braddon site at the moment.
Yeah, because this isn't a construction site, it's,
Right.
it's an apartment building,
Oh, an apartment
essentially,
building.
with a bit of commercial real estate down the bottom.
Not that I'm specifically aware of, but I wouldn't be surprised. Thank you.